Okay, let's unpack this. Welcome to a deep dive into, well, the evolving world of marijuana use and its risks. Things have changed. Our mission today to really distill the current science, cut through the noise and help you understand the real impacts.
Absolutely. And what's fascinating really is just how much that risk profile has shifted. I mean, think back to the 1990s. Cannabis then averaged less than 4% THC.
Less than 4%.
Right. But jump to 2022, and that's often quadrupled. We're seeing around 20% THC pretty commonly. And concentrates, they can hit like 80, even 90%. It's astronomical.
Wow.
This huge jump in potency, it fundamentally changes the whole risk equation.
Yeah.
Old assumptions, they might not hold up anymore.
That potency shift alone sounds like a massive factor. So, okay, beyond that initial high people expect, what are some immediate effects, maybe less obvious ones someone might experience?
Well, almost instantly, like within minutes of inhaling, your heart rate can spike. We're talking 20 to 50 beats per minute higher.
That sounds significant, especially for some people.
Exactly. If you have any pre-existing heart conditions, that's a real danger zone. But here's something really crucial and often missed. That feeling of being high might fade, but the cognitive and motor impairment, that can stick around for over 24 hours. Things like coordination, reaction time, judgment, they're still affected.
Over 24 hours, so you could feel totally fine but still be impaired.
Precisely. Which has, pretty big implications for things like driving or public safety. And with really high doses, we sometimes see acute psychosis, temporary hallucinations, paranoia, that sort of thing.
Okay, that 24-hour impairment window is definitely surprising. What about long-term, more frequent use? What does that do, especially to the brain?
Yeah, that's a critical question.
Yeah.
Because remember, the human brain keeps developing until you're about 25.
Right, that late maturation point.
So regular cannabis use, especially starting young during adolescence, it can lead to lasting cognitive issues. We're talking potential impacts on short-term memory, how well you learn new things, and some studies even point towards a measurable drop in IQ scores over time.
And mental health.
That's another big one. Chronic use, particularly with these super potent products, or starting before age 16, it significantly bumps up the risk for psychosis and schizophrenia. And kind of ironically, for people using it maybe to self-medicate, daily use can actually make existing anxiety and depression worse.
Seems counterintuitive. Are there other maybe unexpected impacts beyond brain health from chronic use?
Yes, absolutely. Something really paradoxical is cannabinoid hyperemesis syndrome, CHS.
CHS.
Yeah, despite cannabis often being used against nausea, some chronic heavy users develop these intense, recurring cycles of severe nausea, vomiting, and abdominal pain. It really shows how complex cannabis effects can be.
Wow.
And then there are potential impacts on fertility for both men and women. Plus, if used during pregnancy or breastfeeding, THC gets through. It can affect the baby's brain development or pass into breast milk.
So there's a lot to consider there. Given all these different factors, how do we start thinking about managing the risks? What really makes a difference?
Well, the main thing to grasp is that marijuana use isn't just one thing, right? Your individual risk really depends on key variables. There's the potency we talked about. Yeah. That huge increase is critical. Right. Then there's the frequency. Daily use is very different from occasional use. And maybe most importantly, your age when you start. Delaying use, ideally waiting until after 25 when the brain's more developed, that's a huge protective factor.
That age factor seems really crucial.
It is. And another thing, interactions. THC and CBD can interact with a lot of common medications. Things like anti-anxiety meds, antidepressants, even anticoagulants, blood thinners.
Oh, right. That could change how well they work.
Or cause side effects.
Exactly. It can alter effectiveness or ramp up side effects.
Sure.
So definitely something people need to be aware of and discuss with their doctor.
Okay, that interaction point is huge. So pulling it all together, what are the most important harm reduction strategies people should know about based on the evidence? All right, so key strategies would be, first, delay starting if you can, ideally past age 25. Second, choose lower potency products. Look for lower THC, maybe under 10% if possible.
Lower THC, okay.
Third, try to avoid smoking or combustion methods because of the added respiratory risks. Fourth, limit how often you use. Less frequency generally means lower risk. Fifth, and this is critical, never ever drive or operate machinery while impaired. And remember that impairment can last over 24 hours.
That 24-hour reminder again, crucial.
Very. Also, avoid use completely during pregnancy and breastfeeding. And finally, always talk to a healthcare provider, especially if you have other health conditions or you're taking any other medications.
This has been, well, quite the deep dive. It really highlights that the science here is constantly evolving, and it's way more complex than the simple stories we often hear.
Absolutely. And connecting this to the bigger picture, it really makes you wonder, doesn't it? How do we as a society make sure everyone gets access to this kind of nuanced, evidence-based information, especially when there's so much misinformation out there? How do people make truly informed choices?
That is definitely a question for you to mull over. We hope this deep dive has given you a clearer, more comprehensive picture. Until next time, keep digging for knowledge.